yassirli amri wahlul uqdatam min lisani yafqahu qawli. First of all, ladies and gentlemen, I welcome you on behalf of Pakistan Society of Internal Medicine and Lahore chapter. Thank you very much. My talk is on Mpox or monkeypox, that is a new threat in our part of the world. If I exactly remember, as far as my city is concerned, in 2006, we have similar threat of dengue fever. And then we face one of the biggest epidemic that mankind ever faced in 2011-12. Anyway, as far as you can see from name, this monkeypox that is first isolated in lab monkey from Singapore back in 1959. The first human case that was seen was in Congo in 1970, and since then cases are coming from that part of the world. As the name monkeypox carries stigma with it, including those about races, the word by WHO changed to Mpox in 2022. You can see the first case was in 1970, then in 2003 an outbreak in America linked with wild animal, that is clade 2. There are two variants. One is clade 1 that was basically in Congo, and it has two types, clade 1A, 1B, and the clade 2 is outside the world. In 2005, again thousands of suspected cases reported in again in Congo. In 2017, it reemerged in Nigeria and continues to spread between people across the country. In 2021, a case of monkeypox was found in America, and again this resident who had traveled from Nigeria. In 2022, outbreak of monkeypox appeared suddenly and rapidly spread across Europe, America, and then all 6 WHO regions, with 110 countries reporting about 87,000 cases and 112 deaths. If you see Pakistani perspective, the first case that was reported in 2023, overall 142 suspected cases were tested with 9 positive results. In 2024, by October 13, Pakistan had tested about 80 cases and 7 confirmed. If I talk about 2025, till now, we have 2 cases. I don't know whether the last case is still in the hospital or has gone to home. As I already told that there are 2 types or clades, one that originated in Central Africa, clade 1, and the other one that is West Africa, clade 2. The current outbreak is caused by clade 2. Basically, this virus is from orthopox virus family, an enveloped double-stranded DNA virus. As far as transmission is concerned, it has 2 types of transmission. One is primary. What I mean to say by primary infection, that is from animal to animal or animal to human. It may be with a bite while hunting, skinning, or when direct contact with infected animal, or from pox lesions, or ingesting contaminated animal while cooking. Many part of world, it has been seen that people used to take raw meat. So that is maybe another source of infection. As far as human infection is concerned, it is secondary infection, maybe person to person through droplet infection, or when patient come in contact with the patient's body fluid through touching, kissing, or via sex or vertical transmission. There are indirect contact as well, like contact with clothing or fabrics or needles or fomites or material used by the patient. If you see pathophysiology, it has initial viremia and then secondary. Initial viremia is during incubation period when patient having no symptoms. Duration is around 5 to 21 days. Virus is present in the blood. Patient has no symptom. So this patient is dangerous and can transmit infection to the healthy part of world. Then febrile phase, usually fever between 38.5 to 40 degrees centigrade. This is the first sign. Fever is with chills and sweating. And initially, it's difficult to differentiate between dengue fever or malaria. Though this fever has severe headache, myalgias, backache, this you can also see with dengue. And then pharyngitis or cough. Though there are small lesions appear in mouth and anthem towards the end of this phase. This is very important sign. You can see this lymph node. Patient has swollen, tender lymphadenopathy within 2 to 3 days of the onset of fever. And this is the feature that distinguishes monkeypox from other pox virus like smallpox, like chickenpox. Though this lymphadenopathy you can see with the other diseases like plague, arteremia, but remember, rash is not present in those. As far as rash are concerned, usually start from the face, and they are also face, chest, and palm and sole as well. This may start as a macule, papule, and ultimately all part. यहाँ पे एक बात I will share that this type of rash is at the same time, starting from the face, from the chest. If you see the rash in chickenpox, patient presented with, again, fever. Patient is having rash. Maybe on day 1 or day 3, rash is on the face. Day 4, rash on chest. And by the day 4 or 5th, rash is present all over the body. But in this disease, these rash are at the same time. So this is mainly a differentiating point between chickenpox and this mpox. Remember, virus is present in the blood early in the this phase, and then virus is also present in the rash. So you can take the blood for PCR, or you can take body fluid from papule or pustule that can be used for PCR detection. That is a definite diagnostic test for this disease. Again, these rash are usually painful. Again, another differentiating point. These rash usually takes 2 to 4 weeks and then recovery. You can see classical rash. There are complications like keratitis, ulceration, encephalitis, and pneumonia, and secondary bacterial infection leading to DIC, so that can be sometimes lethal. Investigation, as I already told you, that you can use PCR test. Remember, CBC just shows leukocytosis or thrombocytopenia, and Mpox antibodies IgM, IgG, though these are present when rash appear, but they are not diagnostic because they may be false positive antibodies. So, how will you differentiate between Mpox with chickenpox? As I have already told, that in both diseases, rash appear and both are contagious. Chickenpox is very contagious and more readily spread. And rash appear in waves, as I already told. So in chickenpox, rash appear in waves, while in monkeypox, rash appear at the same time. So this is a differentiating point. When you compare with smallpox, though this disease has been eradicated from Pakistan more or less 50 years back, both are orthopox virus and having similar symptoms, but Mpox is milder disease than the smallpox. Thanks to effective vaccine that was once used for smallpox eradication, again that vaccine is 85%, 70 to 85% protective for this Mpox infection. This vaccine should be given in 2 doses, 4 to 6 weeks apart, and person is said to be fully vaccinated 2 weeks after the recipient of second dose. This disease is self-limiting. Most of the people will recover within 2 to 4 weeks. Treatment is supportive. Medication like brufen, Panadol are need to be given for pain, fever, though there are few antivirals that are being used for other viral diseases can be used in this Mpox. Like we have 2 medicine, like one is tecovirimat, 600 milligram twice daily for 2 weeks. And in serious infection, this can be used IV formulation as well. The other is cidofovir, again that is for ophthalmic involvement. One thing that is very important, there is no randomized control trial for this tecovirimat. However, there are small series of few patients where it has been seen when you use this drug, virus or PCR become negative within 48 hours. General measures, patient should be given oatmeal bath. Soaking in warm bath with colloidal oatmeal can relieve the dry, itchy feeling. Patient should be isolated in a single room once he is having infection. Avoid contact with padding or other material to avoid indirect transmission of this virus. While handling these patients, doctor, nurses, or paramedics must wear personal protective equipment. In summary, this virus within 4 days, he or she should get vaccine that is protective. Thank you very much.